Okay, just a quick one. Today we want to review what we call a non-union as far as fracture management is concerned. So this is a 44-year-old male who had the trauma about 5 months ago and has been massaging this fracture at traditional bone setters where they have been rubbing different herbs and massaging with different, lubricants to come up with a solution. But all in vain. Remember, the process of fracture healing starts immediately. You get the fracture with all that inflammation and the hematoma that collects around the two fragments which have gotten broken. And then that very hematoma goes on in two different stages to harden and form the colors, becomes sticky, up to when it hardens to bridge up the gap between the two fragments for you to unite. But when you expose this bone to repetitive movements as you are massaging or as you are rubbing, whatever you could be rubbing, you are exposing this bone to early mobility between the two fragments which got broken. And what happens is, one, you are not giving the two fragments ample time or a conducive environment for them to become sticky by the other colors or by the other new bone which is forming in between them. Two, you are making the two edges of the bone where the fracture occurred like mobile and they rub over each other. When they rub over each other, they are going to form smooth surfaces. So in this, you'll be like creating new edges of a new bone, of which the edges you are creating, it is just a fragment of where the bone fractured. So in this way, you'll be like creating a pseudo joint, or pseudo joint, which ordinarily known as a false joint. So you're creating a joint where it's not supposed to be, which is a cardinal feature of a non-union. So we shall define a non-union in fractures as a condition where we have absence of either clinical or radiological features of a united fracture when the treatment time has elapsed in a particular fracture in a particular age. Because remember, each and every fracture or each and every bone has a particular time that it is expected to heal. It's a range depending on the age and also other factors, not putting them aside like nutrition, age, the blood supply, the health status of the patient, and so on and so forth. So when we have totally absence of those two features, examine the patient and there are no features of union clinically. And also when you look at it radiologically, as we are going to see, there are features of no union. So that's when we can define it as a non-union. So what are some of the clinical features which we can look out for in these patients with a non-union? One is pain. This pain is variable in a sense that it will be more when this patient tries to use the limb, because you're using the limb which is not anatomically well aligned. Then two, there could be swelling because of the repetitive rubbing and damages to the tissues around. So every day you are trying to renew the inflammation that is taking place. Then thirdly, the cardinal feature, which is a pseudo joint. And this will be manifested more, for example, in this, let's say it's in a forearm or in a tibia fibula, in a leg. Now, when those two bones are fractured, so you will have a joint where it is not supposed to be, or it's not expected. Thirdly, we can have deformities, of course, because we didn't have union where the fracture had occurred earlier. Sometimes we can have crepitations. Like crepitations are like sounds made when the two bones rub over each other. This is usually seen in examinations, or sometimes when the patient is performing some movements. Then radiologically, of course, we shall see a fracture line which is visible on an X-ray radiograph where the fracture had occurred earlier. And sometimes there could be a soft tissue within the gap because of the repetitive rubbing of this limb. Then also we can have displacements as they happened earlier alone or during the use of the limb that is not fully functional. Then you can have a bit of soft tissue swelling around the area because you are going to keep on exerting force on this limb that is not fully functional or that is injured. So you are renewing inflammation each and every day, and inflammation comes with swelling. Then smooth edges, of course, if you try to follow that lining of the periosteum and up to where the edges of the fragments are, you almost have the same like texture. Then also we shall have a periosteal reaction. This is a little radiological. Yeah, and of course plus some other features which can happen at an individual level here and there in different patients depending on their experiences. So you are always advised to seek professional advice in a hospital or in a health center so that you can avoid this, because it is costly both as far as the time and your funds are concerned. Thank you.